Okay, so looking at the bones. Now, one of the things I want to say, well, there's a couple of things I want to point out about the rib cage. When we talk about the rib cage, yes, protecting some pretty vital organs. Lungs, heart, we get a little bit of protection over our kidneys. Not a lot, okay, but we do get some. Now, when we talk about the rib cage, at the time where we do the practical, I would not ask you to tell me, is this pair number 3, 4, 5? I wouldn't ask you to do that, okay? I do want you to notice that for ribs 1 and 2, they are very distinguishable, okay? Because they are flat and very C-shaped. Now, when we look at the rib cage, one of the things you note is we've got quite a bit of cartilage that's present. This cartilage, right in my eye, the cartilage is called costal cartilage because it's only the cartilage of the rib cage. Now, what we find is that we are going to have true and false rib. If it is a true rib, it attaches directly to the sternum by way of cartilage. If it is a false rib, it attaches to cartilage that attaches to cartilage above it that attaches to the sternum. Does that make sense? And then we got what's called floating ribs. So 11 and 12, these are floating. When you look at their attachment to the back, the ribs are attached to thoracic, so T1 through T12, all right? And due to the articulation of these, there's a very cool articulation to the ribs. So a couple of things to note about the ribs, but I would not dare ask you them separately, okay? There are some, I think some of the articulating surfaces that I want you to know on the ribs, but not a lot. When we look at the sternum, it's made up of 3 parts. We've got the manubrium, the body, the xiphoid process, little piece that sticks off at the bottom. As you move into the appendicular skeleton, because that is now done with my axial. I now have my appendicular skeleton. We're going to say that we have some girdles. Ladies, well, actually men now too. Okay, we can know what a girdle is, all right? For our purposes, there is one for the upper, one for the lower, where we have the attachment to our upper and lower limb. We're going to have the shoulder girdle, and we're going to have a pelvic. The upper limb, and this is always kind of cool, okay, because somebody might come in and go, my arm hurts. All right, no. That's not the correct way, okay? Arm, forearm, wrist, hand. All right? When we look at the leg, all right, what is hard, okay? You know, when we look at the leg, okay, thigh, leg, foot. All right? So they might come in and be, make sure you got whether it's the thigh, the leg, or the foot. Upper limbs, carpals, lower limbs, tarsals, T before T. One way to remember it. On the shoulder girdle, what we also know is the pectoral girdle, we're going to have the scapula. The scapula, when you look at it in the boxes, it is a very unique bone. Alright? It's got these little processes coming off of it. It's got the point where the head of the humerus can fit into it. The structure of this keeps us having the ability to be able to move our arms up, down, and in a 360-degree motion. Okay? Even though we have a similar structure in the pelvic girdle, we don't have a full 360. We got 360. Okay? But it's not that. Alright? So, the clavicle, something that a lot of people break when they fall and brace themselves, because when they fall and try to brace themselves with their hand, all of that pressure gets pushed up to the clavicle and can break the clavicle. As we look at the humerus, once again, please don't tell me that that's the femur. All right? There are definite differences, even though very similar, okay? Definite differences at the head, and even if you look at the articulation to the radius and the ulna. Okay, definite differences in the humerus and the femur. In that forearm, we've got our radius and our ulna. One way to remember the difference, the ulna leads to the pinky, that spells up, okay? Radius has a radial head, okay? So that's one way to help remember that. The ulna goes over talking about some of these processes, because, you know, you got your, what we call the funny bone, all right? And there's nothing funny about it at all, okay? If you hit it, okay, trust me on that. So that gives you the structure that makes it up. It's kind of cool, that articulation to the humerus, making up the, what we think of the elbow and the funny bone. These are the areas of palpation. Now, for the carpals, I don't think I have you identifying them separately. I think I have you identifying them as a whole. Okay, that these are the carpals. In the hand, metacarpal, phalanges, the digits. Okay, that's an example of the wrist in the hand with the carpals, the metacarpal, the phalanges. The phalanges have their proximal, middle, distal, okay, portion. Be sure to note that. In the pelvic girdle, it's going to talk to you a little bit about some of the features. One of the things about our hip bones, what we think of as our hip bones, those are actually three bones joined together. They're going to be the ilium, the ischium, and the pubis. These three bones joined together make up our coxal bone, which to us we think of as our hip bone. All right. Then it starts talking to you about some of the areas of the articulations, like to the femur and so forth. When we look at the lower leg, femur, patella, tibia, fibula, my tarsals, metatarsals, phalanges. Once again, proximal, medial, distal. Okay? The coxal bones, they'll talk to you about them. There is a difference between the hip bones of men and women. Okay? Women are shorter and wider because we have to carry the young and give birth. Alright? Basically, that's why. This is giving you the breakdown of the ilium, ischium, pubis, and the three different colors. This is showing the difference between a male and a female, and of course why, because we got to give birth. The differences between the male and female. When you look at the femur, once again, similar to what we see with the humerus, but there's a difference in the structure of them, so be sure to note the difference. One of the things about the femur, you can always tell because they're going to have this fovea capitis. They're going to have that represented in almost all of the models. That's where a really huge ligament is attached, making that hip, connecting it to the pelvic area for the movement and the rotation. So they try to represent that hip that's found. Now, when we look at the patella is a sesamoid bone, meaning it's a bone that grows in a tendon, the quadriceps tendon. So that would be the patella, sesamoid, like sesame. That's how I make that there. Sesamoid, all right. The lower leg with our tibia, the fibula, their connection, one of the coolest things about their articulation is they create our ankle bone. What we think of as the ankle bone, but their connection that they get allows it to sit and have the ability to rock in many ways so that we can walk. Okay? So that articulation is pretty cool. I like the malleoli, all right? The lateral and the medial malleolus, which is something you have to be familiar with. Then for the foot, where we're going to have this really huge bone, that's talus, the calcaneus, the calcaneal tendon, Achilles tendon. Heard somebody on a radio show, and the answer was Achilles tendon, and they said Achilles, and got the answer. Or was that on Jeopardy? It was on something, okay? And when they called it Achilles, I was just like, But anyway, okay, the Achilles tendon, don't know about that, like you cut it too long. Right. So, the calcaneus, the talus, then we've got our tarsals, metatarsals, the phalanges, the arches of the feet. Because we have the arches, we do. Okay? All right? Because we have the arches that we do. We have an arch that goes this way, and we have an arch that goes this way. Because of these arches, it is the reason we walk upright. Technically, we're not supposed to, okay? But because of the development of the arches of these feet, we are bipedal, meaning walking on 2 feet upright. So, when you begin to look at those structures and the way we distribute the weight, those arches, the transverse, and the longitudinal are the reason we get to walk upright. Any questions? Transverse goes across this way. Longitudinal is the long axis. So if you look like this is the longitudinal, this is long, and this one is the transverse. Okay, so lab 10 is continuing with the studying of the bones.